So we have our next speaker now lined up. Now, by the magic of technology, we have Faye Dickinson who's going to talk to us. And Faye is a physiotherapist based at the Royal Marsden. So she's going to talk us through the benefits of exercise and keeping well. So I believe she is anyway. She says, I really do wish I could tap dance at this point. She'll be here any minute. Now, there she is. There. Hi, Faye. So Faye wasn't able to join us because Faye's actually got COVID. So yes. So thank you very much indeed for making it today, Faye. So they're all in the room waiting to hear from you. Okay. So I'll get you to then switch your screen over and then you can share your slides. All right.
Okay, can everyone see and hear me okay?
Yep.
Yep, brilliant. Okay. Thank you so much for inviting me to talk today. And firstly, my huge apologies for not being there in the room with you. As Deborah said, unfortunately, I got COVID this week, so I couldn't be there in person, which is such a shame because I was really looking forward to it. But I'll do my best. I might be a little bit slow still, and apologies if I have to pause to cough and have a drink of water. I'll try not to cough into the microphone because I'm pretty sure that won't be too pleasant. And as Deborah explained, I'm a physiotherapist by background. So I've specialised in lung cancer since 2016. And I was working at Guy's and St Thomas's Hospital, actually, in a supportive clinic for patients with lung cancer. So in the clinic, there's physio, dietitian, OT, and we see patients from point of diagnosis and along the treatment pathway to try and optimize them. So I'm going to talk a little bit about the importance of prehab and exercise. I'm now working as a cancer rehab ambassador as well. So I am working across several different trusts in London to try and improve access to cancer rehab and improve the quality of cancer rehab. I will try and keep it as interesting as possible. I've had to make a few changes because I'm not there, but we'll do what we can. And I'll try and take some questions at the end. And also I've put my email address up here because I know I'm not going to be around in person to ask any questions, but I'm more than happy for you to email me anything if you're not able to ask it at the end. Okay, so to begin with, what exactly is prehabilitation? So Deborah asked me to come and talk about the importance of prehab, but we need to know what that is first. And I think it's a word that we might have heard of because we might have seen that in the media. We might have heard it at the hospital. It's kind of the word that's hot on everyone's lips. But prehab is actually part of a broader term of rehabilitation. So it's really important first that we understand what rehabilitation is and how it all fits together. Wow, I mean, this is a lot of writing on this slide, isn't it? And I don't expect you to read through that whole big description. What I'm going to do is kind of highlight a few key phrases and a few key words and tell you about what I understand to be rehab and what the definition says as well. So rehab is a bit of an umbrella term, and really it's about enabling people to make the most of their lives by maximising the outcomes of their treatment and minimising any consequences of a treatment or any symptoms that they do have. So the need for rehabilitation starts from point of diagnosis by helping people to prepare for their treatment. And that's that term that we use, prehab. So that's what we can do to optimize people before their treatment. But then rehab should continue. So it's not just about what you can get before treatment. Rehab should continue throughout the pathway to help people to address any problems that are caused by the treatment or any problems or symptoms that they have from cancer. And it's about maximizing people's ability to function, be that your physical function, but also your psychological, vocational function, and generally how you're managing. So it's about promoting independence and supporting you to adapt to the condition and kind of face those challenges that you face. And what's also really important, and I want to highlight this here, is that rehab isn't a one size fits all, and prehab isn't a one size fits all. So rehab should be very much kind of individualized around a person and what their needs are and what any kind of problems or barriers or concerns that they have are. Often it's holistic and it's multi-dimensional and multi-professional. So when we talk about the term rehabilitation or prehab, that can be provided by physios, dietitians, occupational therapists. And obviously the type of rehab that's being provided will be very different based on what professional is providing it and also the individual who's receiving the rehab. But what all the evidence shows us now is that rehab is an integral and essential component of cancer care, and it should not be considered to be an add-on. So everyone should be able to have access to rehabilitation and prehab. So this just puts things into kind of a bit of a clearer diagram again of how the prehab and rehab fit together. So prehab is about impairment prevention. It's about preparing for anticipated stress and impairments. And rehab is continuing on from that. It's about impairment response, and it's about addressing impairments that might come from treatment or come from the cancer. And rehab is really important at every stage of the cancer journey. So I was going to try and get really fancy here and kind of do a poll and do a kind of truths and myths about prehab, but I've chickened out of that because of the situation. So what I've got instead is I've got the questions up here, and I thought maybe you can kind of just raise your hand if you think it's true from what I've said or from what you know, and maybe not raise your hand if you think it's false. So the first question is, prehab helps to optimize physical and psychological function and reduces severity of current and future impairments. Do we think that's true or false? So raise your hand if you think that's true. Brilliant. I can see the room, so this is quite handy. Great. Okay, I'm going to come up with the answers at the end. Prehab is just about exercise and improving your physical fitness. So raise your hand if you think that's true. Oh, good. Okay, next question. Prehab is just for patients having surgery. So raise your hand if you think that's true. Good. Okay, and next one. Prehab can be about maintaining someone's physical function. True or false? So raise your hand if you think that's true. Great. I can see a few hands raised. Two more questions. Prehab incorporates many aspects of your health and well-being. So raise your hand if you think that's true. Great. And last question. Prehab is limited to a certain period of time. So raise your hand if you think that's true. Excellent. It's a bit of a trick question there. So it's true that prehab is to try and help optimize physical and psychological function and reduce severity of current and future impairments. But it can also be about maintaining someone's physical function. And it should incorporate many aspects of your health and well-being. But prehab isn't just for patients that are having surgery. Traditionally, that's kind of been how we view prehab, because there's a lot of kind of nice packaged prehab programs for surgical patients and not so much for patients who are on other treatments, but prehab should be for anyone who's on any treatment. It's not just about your physical fitness, and it shouldn't be limited to a certain time period. So it should be, as I said, prehab should roll into rehab and continue along the pathway. So this slide is to kind of show you what interventions we might expect from rehabilitation. And obviously I'm going to go on to talk a lot more about exercise as well, because that's where kind of a lot of my my experience and excitement is in the kind of benefits of exercise. But what we know about rehab and prehab is that it should be a multimodal approach, and it should have several interventions to cover several different areas. And as I said, this should be individualized towards the person. So for some patients, they might need advice on smoking cessation or alcohol, but many patients also won't need that, but they might need support with sleep hygiene, or they're having difficulty sleeping and want some advice around that. Exercise is a huge element of prehab. That's the kind of one of the key interventions of prehab and rehab. And a lot of the evidence looks at, for kind of prehab and treatment before treatment, rehab before treatment, looks at the benefits of exercise for those who go on to have surgery, but actually there's a huge amount of evidence for exercise at every stage of the cancer journey, and there's a huge amount of evidence for exercise for patients who have advanced lung cancer as well. But we know that the exercise needs to be adapted to the individual. It should include aerobic and anaerobic exercise, strengthening exercises, and sometimes it has respiratory and breathing exercises as well. Another thing that a prehab program can include is nutrition, and I know you've had a talk already this weekend on kind of the truths and myths about diet and the kind of benefits of kind of your diet. And really, when we're thinking about it from a rehab perspective, we're thinking, how can we optimize your diet and also help with making sure that you've got adequate nutrition for your skeletal muscles and to kind of be strong enough for treatment. And then stress management is so important as well. Often when we're thinking about prehab and getting in intervention early, this is a very high anxiety time, because it might be that you've had your diagnosis and you're waiting for treatment, and it's important to kind of be able to have support at that time and know, be offered support and strategies on kind of how to help with stress management and anxiety reduction. So that's a big part of prehab as well. And also we want to be able to talk to people and prepare them for the treatment that is to come, because I quite often hear that people don't quite know what to expect from treatment. So that's why it's important to be able to have psychological support if you feel you need it, but also have peer support as well, really. And then depending on the individual, there may be other interventions included, which I've included on the left here. And as I said, on the right, you can see this is just a small selection, but there can be a number of different healthcare professionals who can be providing prehab. So we know that prehab can help improve physical fitness, it can help to reduce the side effects of treatment, and it can also help you to cope better with side effects. This diagram on the left here has been adapted, but what it tries to show is that at diagnosis, you've got your general health on the left and time along the bottom. So prehab is about trying to optimize you, about getting you as strong as we can. So you can see that general health can improve with prehab. And then once you start treatment, there might be, and I say might, there might be a decline in your general health. And this particular diagram was lifted from something where they've been looking at that the decline in your general health that you might have with something like surgery or radiotherapy, which is a little bit different because you might be anticipating more pain, more respiratory compromise and things like that with surgery, but it's still relevant for any treatment. There might be kind of a dip in general health while you're then picking yourself back up again, but you're at a better point if you have prehab and you start exercise and interventions early. You're at a better point to then respond. And with rehab, you're going to respond and recover quicker than without any rehab support at all. So how do I get prehab? Well, this is quite a big question, isn't it? Because according to kind of the guidelines that are now out there, there should be uniform access to rehabilitation and rehab along the whole pathway. But we know that this currently varies significantly across the UK, and prehab isn't available at every centre. But there should be some support available. So unfortunately, what it might be is a case of kind of collecting the pieces of the puzzle together yourself, asking what rehab or prehab support is there, identifying, actually, I think I need support with my nutrition. Actually, I think I would like some support with physical activity, and then asking for that. And then you should be able to start to access the rehab offers that are available. But there also are some things that you can do for yourself. And one of those big things, and kind of key thing that I really want to talk about, is exercise. So let's talk about exercise. So what's very interesting is that in the last 10 years or more, there have been more than 2,500 randomized control exercise trials in cancer, and there's actually more evidence to support the benefits of exercise in cancer than there are for exercise in heart disease. In heart disease, exercise is kind of quite a standard treatment. So patients who have cardiac disease might be referred to something called cardiac rehab, but quite often we're not hearing people talk about exercise in cancer. But it's really important that we start kind of promoting this and talking about it more, because the evidence is so strong. Despite all the evidence, only 1 in 3 people living with or beyond cancer, 1 in 3 people are completely inactive. So that's something that we want to try and improve. So why is being active so important? So there's a multitude of benefits of being active, and you can see some of the benefits here on your screen, and I'll talk through some of them. This is for every type of cancer as well. So we know very strong evidence to show that being active can actually help to improve cancer-related fatigue. We know that it can help with things like joint pain. We know it can help with things like improving your cardiorespiratory fitness. It can help with muscle strength. And it's also got a strong association with helping with anxiety and depression, because when we exercise, we release those endorphins, those feel-good hormones that can actually help with mood. So there are many, many different benefits. So I've got another question now. Don't worry about scanning the QR code because I'm too scared that's going to go wrong. But hopefully you can see up on the screen on the right. How much physical activity do you think we should be doing a week? So I'm going to read these out, and then again, I might try and get you to raise your hand with the answers. So should we be doing 30 minutes a week of walking? Should we be doing 150 minutes of moderate intensity activity plus 2 days of strength training? Should we be doing 75 minutes a week of walking? 30 minutes, 5 days a week of moderate activity? Or being on my feet most of the day? Right, let me see if I can just make you a little bit bigger on my screen. No, I can't. Okay, I can see you well enough. So raise your hand if you think we should be doing, the guidelines say that we should be doing 30 minutes a week of walking. Okay. Raise your hands if you think we should be doing 150 minutes of moderate activity plus 2 days of strength training. Good, I can see some hands raised. And then raise your hands if you think we should be doing 75 minutes a week of walking. Raise your hands if you think we should be doing 30 minutes, 5 days a week of moderate activity. Great, a few hands there. And raise your hand if you think that it's being on your feet most of the day. Okay, great. I can't see any hands for that one. Well, I'm going on to give you the answer. So these are the guidelines. These are recommended for all adults, and this includes anyone living with cancer. So we want to be aiming for 150 minutes of moderate intensity physical activity per week, and that equates to 30 minutes, 5 days a week, and that's as a minimum. We also want to look at building strength on at least 2 days a week, and this is particularly important when we're talking about exercise and living with cancer, because we do want to be thinking about the benefits of that to our muscles, bones and joints. We want to try and really minimize the time that we're being sedentary. So break up periods of inactivity with doing activity or exercise. And for older adults, or for someone who has had any falls or difficulty with their balance, then it's good to try and incorporate 2 days a week of balance exercises. These exercises as well can be adapted to things that you enjoy, so it doesn't have to be your kind of traditional exercise program. So for example, with your balance exercises, that could be things like dance, it could be things like bowls. Building strength can even be things like carrying heavy bags or kind of doing body weight gym exercises as well. And moderate intensity activity can be things like walking and swimming. And I'm going to go on now to talk about what does that moderate intensity actually mean. So moderate intensity, as it said on the previous slide, is about being able to talk but not being able to sing a song, which I always think is a really weird way of putting it. But what we mean is that you should be feeling a little bit more breathless. You should feel like your heart's going a little bit faster. You should be able to talk, but your sentences might be a bit more broken up, or you might start to feel a little bit more short of breath with your talking. So, for example, if you were kind of walking at a gentle pace, not feeling any breathlessness, not feeling sweaty, not feeling your heart, that would probably be a light intensity. But if you were to increase the pace that you were walking, or walk carrying a bag, for example, or go up and down the stairs, that would be classed as your moderate intensity. And then other things as well can be moderate intensity. So things like swimming, I know in this diagram here, they've put it as vigorous, but obviously that depends on how fast you're swimming and things like that. So what you need to remember about moderate intensity is it should feel like your heart rate's increased, your breathing rate's increased, and therefore your energy consumption has actually increased a bit as well. So are we a bit like the sloth? I know I have definitely been the sloth for the last few days while I've been poorly. Evidence shows us that many adults spend more than 7 hours a day being sedentary. And on average, people with cancer spend more than 10 hours a day being sedentary. And traditionally, we've been told when we're poorly or when we've got, if you've got cancer, you need to rest and not exercise. But actually, as I'm saying, a lot of the evidence now shows the opposite, and that we need to try and improve our physical activity. There's been more than an analysis of more than 9,000 people with cancer, and they found that only 30% of those people were meeting the current physical activity guidelines. But I think a number of people aren't aware of the physical activity guidelines, and it's probably something we don't talk about enough at the hospital either. And in general, we need the whole population to be being more active, because inactivity is the fourth leading risk factor for mortality according to the World Health Organization. So with that in mind, and because I've been speaking already for quite a few minutes and might be starting to lose a few people, I'm going to spend 1 minute trying to get us moving a bit. So it's going to be quite a challenge for me over here. But what I'm going to ask you to do is, if you've got space where you are, we're just going to do one exercise, and we're going to do it for 1 minute. And all that exercise is standing up from the chair and then sitting down again. And there are different ways that you can do this exercise. Oh, you don't have to start yet. I'll give you a timer. You don't have to start yet. So let me just get my stopwatch up. You can use your hands to help you, or if you're feeling quite strong, put your arms out in front of you and try and stand up and sit down without using your arms. If you want to take it easy, go at a nice slow pace. If you want to push yourself a little bit harder, see how fast you can go and how many you can get in a minute. Okay, so I've got a timer in front of me now, and I'm going to get going in 3, 2, 1, off we go. Probably going to start hearing me breathing quite fast through the microphone in a minute as well, because I need to be doing this. As I said, I've been far too sedentary for the last few days. Okay, this is quite hard. So this is a really good exercise to actually get your cardiorespiratory function going. So to get your breathing rate a bit faster, to get your heart rate a bit faster. And it's also helping to strengthen our quadriceps, our hamstrings, and our glutes, which are some of our major muscle groups. So we're more than halfway through. We've got 20 seconds left. Keep going. Ooh. Right. 10 seconds. I'm not counting. Hopefully you are. And 5, 3, 2, 1, and rest. Okay. Well done, everyone. Hopefully everyone's feeling a bit more awake after that. A little bit short of breath. Maybe your heart's going a little bit faster. Maybe your breathing's a bit faster. I know mine is. Okay. So, moving on to talk about exercise. Where do I start? Anything is better than nothing to begin with. So, what I want you to think about doing is breaking up sedentary tasks with walks, sits of stands like we've just done, or maybe standing up, maybe getting up to go up and down the stairs. When you begin, it's better to be doing frequent bouts of activity and breaking up those sedentary periods rather than being kind of weekend warriors. And what I mean by that is waiting until the weekend to do all your exercise and then finding that you're absolutely exhausted after that. Build yourself up for 10 minutes at a time. So when you first get started, you might be able to do 10 minutes, then 20, then 30. And then once you're finding that you can exercise comfortably for 30 minutes, you can start to increase the intensity. So it might be that you know you can go for a 30-minute walk, but actually then what you can do is try and go for a 30-minute walk at a faster pace, or you can tackle that hill and see how you feel. But it's a good idea to try and build up slowly, particularly if you're completely new to activity, build up slowly over a few months. But I'm on treatment. Yes. So even though you're on treatment, it's still really important to be doing exercise. And there have been quite a few randomized control trials and a systematic review looking at those randomized control trials. And they've shown that exercise is safe in advanced lung cancer on treatment. And there's very few incidences of adverse events or problems happening. And actually, they also found that those who did exercise with lung cancer had a better quality of life, and it can help a lot with the symptoms. You'll know yourself that you'll have days that are good and days that are bad. So just try and plan things around that. So try and plan higher levels of activity on your good days and lower levels of activity on your not so good days. We know that during certain treatments you can get fatigue. So I know on a number of the targeted therapies, fatigue can be a big problem. And also it's quite common with things like radiotherapy. And with radiotherapy, you can often get this kind of build-up of fatigue, but it's still really important to continue to do some physical activity because it's going to help you to improve your ability to tolerate your treatment, even if you do feel a bit tired. So you might just need to adjust things a little bit. So how do I exercise? So I would encourage a warm up and cool down, so for 5 to 10 minutes to help minimize discomfort, especially if you have joint pain. And what I find a lot as well is that if you have lung cancer, it's good to try and incorporate some stretching exercises for your chest and for your shoulders. Because what can happen is if you have pain in your chest or in your shoulder, or if you have pain anywhere, but this is where I find a lot of people do have pain, you can become quite protective of that area and you can become quite stiff because you want to protect it and you want to avoid pain. But that can actually make the problem worse. The other thing that can happen is if we've had pain, if we've had a procedure done, if we've had a drain, then we can actually get pain inhibition of some of the muscles as well. So we need to make sure that we're trying to stretch. So that can be things like following a simple kind of yoga program where you're doing kind of arm elevation and you're doing some thoracic expansion, thoracic extension, sorry, and rotations. But basically just trying to move your shoulders and move your spine in a way that feels kind of comfortable for you. So it might be that you don't want to push too far into pain, but you do want to make sure that you're not getting stiff. When you're doing your exercise, try and get a mixture of aerobic activities, so that you might like walking, you might like jogging, you might just want to be doing the stairs, or there might be a particular exercise that you do enjoy doing. But also think about your strength training and your strength exercises. So we want to be doing strength exercises to cover all major areas of the body, so bum, tum, arms and legs. But you don't necessarily need any specialist equipment. You can do things like press ups against the wall or the floor. You can do sit to stands like we've just done. You can do squats, lunges. You can also do things like some weighted arm exercises with bottles of water or tins. Be aware that it is common to lose muscle strength during and after treatment, and there will be ups and downs in that as well, depending on how you're kind of feeling at that time and what particular treatment that you're on. It's also quite normal, particularly if you're quite new to exercise, to be feeling some soreness, but that should improve as your body adapts and strengthens. But it's really important, I think, to know what's normal for you. And when I do see patients with lung cancer, it's so good to be able to see people starting exercising and also being familiar with their bodies and knowing what then feels right for them and what doesn't. I think it can really help you to kind of get quite in tune with your body as well. So what about breathlessness? This is quite a big question because, again, traditionally, and I think in our brains, we think that if we feel breathless, we shouldn't be exercising, we should be resting, or it's natural to want to avoid the exercise that makes you feel breathless because it feels unpleasant. But actually, exercise can help with breathlessness because we're helping to improve your muscle strength and your pulmonary function. And as I said, we actually want you to be feeling a moderate level of breathlessness during exercise to help your heart and lung fitness. But if you're really struggling, if you feel like you're feeling more breathless than you should be, or if you're feeling quite anxious, so if getting breathless kind of triggers any anxiety or any worrying thoughts, like you're not getting enough oxygen, then that's a good point to kind of ask to speak to a physiotherapist who can go through some breathing strategies when you're exercising, or adapt the exercise to help you so that that's not worrying you so much, or just to make sure that you're at the right level, exercising at the right level. And what about fatigue? So, as I said, fatigue is actually physical activity is actually the #1 treatment for cancer-related fatigue. So there's really strong evidence to show that exercise can help with fatigue management. And the exercise recommendations for fatigue are that we should be doing 30 minutes a day for 3 days a week of activity at moderate level. So if you're feeling really fatigued, you might need to reduce your activity a little bit. So you're doing 3 days a week rather than 5 days a week, but you definitely don't want to be reducing it altogether, because if we become sedentary when we're fatigued, then our muscles get weaker and we actually go into a vicious cycle of the fatigue actually being worse. And it's also still very important to be doing your strength training 2 days a week, but it should be at a moderate intensity and of about 12 to 15 reps of an exercise. And as with any fatigue management, when we're thinking about our exercise, it's important to plan, pace, and prioritize. So what I mean by that is that you need to prioritize this and fit it in with the rest of your life. So it might be like you know that you're feeling tired this week and you know that you need to do some exercise, but you really wanted to see your friend or family member. Maybe you can plan that you'll have a short walk with them, and you'll plan for it to be in the morning when you're feeling a little bit more energetic. So you're kind of prioritizing that family time, but planning in a bit of exercise at the same time. And you might know that there's some different spaces on that walk where you can stop and have a rest to pace yourself, or you might just make it a little bit shorter than you would do normally so that you know that you've got a little bit of energy left for when you do get home. And what about bone health? So when we age, we know we can get some age-related bone loss, and also we can get bone loss from some common treatments like long-term steroid therapy. And of course, we might also be thinking about metastatic disease in the bones, but exercise can still be very safe and beneficial. So if you're particularly concerned about an area, or if you have a fracture or you're concerned about fracture, then you can speak to your oncologist or physiotherapist for guidance. But generally, we will still exercise with people who've got bone disease, including kind of widespread bone disease, because actually having some weight bearing exercise and some kind of strengthening exercise alongside aerobic exercise, it can help with things as well. So as I said, generally it's safe to be exercising, But if you have got any of these particular problems or concerns, so things like if you have got COPD or asthma, or if you've got concern about a hernia, then you might want to speak to your oncologist or GP. Or also if you've got any side effects of the cancer or its treatment, so kind of things related to blood counts, blood sugars, severe fatigue, cardiotoxicity, or if you're worried about your brain disease. And it might be that they just give you the clearance to exercise, or it might be that they refer you on to an expert like a physiotherapist to help you with your exercise. And what about motivation? So I think that can be something we all struggle with sometimes, but I've got a few ideas for helping you with your motivation. So try and keep in mind the benefits of being active and what you hope to achieve. And it can be helpful to set goals, but set goals at your own pace. So don't try and compare yourself to anyone else. And don't feel disheartened if you don't achieve a goal. Just think about what went wrong and try and set a new goal. Sometimes it can be quite useful to keep a record of how you've been getting on with your exercise. There's kind of an example up in the corner here that you can get kind of activity charts, or you can just keep a notebook. Or I was speaking to a patient the other day who had their grandson take videos of them. And I took a video of him walking around the park, and then a few weeks later took another video, and he said that it was really motivational because actually he could just see improvements in even his posture, the kind of way he was walking, his walking pattern. And it was quite a fun activity for him to do with his grandkids as well. It can be really helpful to share your plans with others who are supportive. And for some people, it might be that they like to join a group or class to kind of have that social support. And one of the most important things is try and do activities that you find fun and enjoyable, because it's no use hating an exercise program or hating doing, hating running and trying to run, because you're not going to want to do it. You need to find something that you find enjoyable. And any exercise or physical activity that gets your heart rate going, that gets your breathing rate going a bit faster, is good to be doing. So it doesn't have to be something that you find horrible. So I've got a few ideas in the next couple of slides. So if you do like to walk, there are many things that can help with motivation and with tracking your walks. So you can use your, often people have like a watch or a step count on your phone. And there's also apps like the Active 10 app that can help you to get your 10,000 steps, or it might be that you're building up to 10,000 steps, but it's useful to kind of keep a track on how many you are doing. But there are also walking groups. So there's well-being walks that can help with 20 to 30-minute walks for people with health conditions. There's things like rambling groups and Nordic walking, which I did a course on once, and it was fantastic because I never realized how much walking with poles was such a whole body workout, but it really is. So there's a couple of links on the side here where you can have a look at those. And I saw on the ALK Positive UK website, there's the Walk for ALK, and what a great thing to be aiming for. That could be a goal, to kind of be able to join, a charity walk to raise money, but also and awareness, but also to get you physically active. And then there's something called exercise and referral. So many areas in the UK will have exercise and referral, and many this is usually a kind of a 12-week exercise program that is provided at reduced cost if you're referred by your GP or healthcare professional at a local leisure centre. And many of the personal trainers at these centres will have an understanding of cancer and be able to support you with what exercise is appropriate for you as well. So to get referred, you usually ask your healthcare professional or GP if they can refer you for exercise. What about exercise at home? So I've seen again how brilliant the resources are that ALK Positive UK have. So they've got some exercise sessions and some videos, and I think they do them live as well. So you can join in from home, following in some really fun exercises. Kind of there's some with and some without music, and you can always adjust the level to suit you. There's also apps that you can get on your phone, like the NHS Exi app. There's other videos as well on like the Marsden website, on NHS website, and on the Couch to Fitness app, so you can give you an idea, and you can always kind of try different ones and find what works for you. And it might be that you like running, and there are different options for running as well. So you can get apps to help with your running, like Couch to 5K. And there's also a group called 5K Your Way. And this is a 5K run that runs on the last Saturday of every month at the usual centres where they have park runs at various places within the UK, but not everywhere in the UK. That is a run specifically for people affected by cancer. So the charity do train people up in how to support and kind of run or walk this 5K Your Way. And I wanted to pop this in here because this is a really useful resource, cancercaremap.org. It can help you to find out other services that are local to you. So it is, it kind of has a huge range of cancer-related support services. So things that are run by charities, NHS organisations, community groups, and some small practices or private companies. So it will include things like exercise, but it also has things like specialist massage or nutrition and well-being, financial advice. So there's quite a lot of information that you can find out what's going on near you through Cancer Care Map as well. And that's everything I had to say. So thank you for listening to me, and I will be able to take any questions. I'll stop sharing my screen so you can have my face. There we go.
Thank you, Faye. Thank you very much. Do we have any questions in the room? Or yes, we do.
Hello, thank you very much. Do you recommend the high intensity interval training?
So that's a good question. I think that depends on where your kind of entry level to physical activity is. And if you've been doing high intensity interval training in the past, then definitely that is something that you can kind of return to, or you can build up to high intensity interval training. But it's quite a nice way to do exercise sometimes. And actually, when I'm working at the cancer centre, one of the things that we do is a circuit type class where we might have 3 minutes on an exercise and then a bit of a rest while we move over, and then another 3 minutes. So actually interval training is a really efficient way to get your exercise done, but it's that high intensity. It doesn't necessarily have to be high intensity. You can exercise at high intensity if that feels right for you, but for some people it might be more of a moderate intensity interval training. Hopefully that answers that question.
Hello. Yeah, is there any evidence to support that exercise helps with the medication penetrating to the blood? Because I've actually got metastases in the brain. So would exercise help with medication? I did read somewhere quite a while ago that the medication that you take would help to circulate more, but when you're doing exercise, but I don't know, is there any evidence on that?
That's a really interesting question. They've looked at that in some other cancers so that they know that it can help with things like prostate cancer. And I think when we're looking at certain types of treatment, perhaps hormone therapies, I'm not sure there's a lot of evidence or research into how beneficial, and also immunotherapies, actually, they have looked at it in immunotherapies and found it to be beneficial in immunotherapy. But I'm not sure that they've researched it in every different treatment modality, and it's not something that's been heavily researched in lung cancer. So it's definitely beneficial, but in terms of actually helping the treatment kind of travel around the body, there isn't a lot of evidence on that in lung cancer with all the different treatment modalities yet, but it has been shown to be beneficial in other areas.
Okay, thank you.
Another question on its way, Faye.
Hi, thanks very much for that. I'm on alectinib, and one of the side effects of that is muscle fatigue. I used to be a runner, but I haven't run since my diagnosis, so I don't know if that is one of my side effects. But when I start running again, if it is there anything I can do to kind of counteract that or to help build my strength so it's less of a side effect? Thank you.
Yeah, that's a good question. So yes, I have seen I've kind of treated a lot of people who have got joint and muscle pain as a side effect of their kind of targeted therapy, and actually sometimes the goal has been to get back to exercise and running. And what I found is that the running won't make it worse. Actually, it can really help with building up the strength again, but you need to build yourself up gradually. So it might be that kind of you follow an app or something, or start with kind of a small period, maybe interval training of a little bit of walking, a little bit of running, and see how you respond to that. Because again, I think it's really important to read your body, and you probably know a lot about how you're feeling, but it's really good to kind of to start off small and then see how you're feeling afterwards, and then build up gradually from that. But exercise can help with those muscle pains that are related to the treatments.
Brilliant. Thank you.
No? Okay. Oh, yes, there is. There's another question over here.
Hi, thank you. I do a lot of walking, running, those cardio type, but I like to build the muscles. And this kind of exercise to build the muscle, I was told that I have to do like a gym type of exercise. But I also heard that you need to be careful if you do the wrong way. It's not actually good for any way of the physically. So I don't know if this is a good idea to go to the gym to do those kind of machine to just in terms of build the muscles, because my muscle is not really enough. So I don't know what's the best way to build the muscles.
Yeah, that's a really good question. And I think, as you said, it's really good to do those weight exercise or resistance exercise to try and build the muscles, because that is so important. If you're a little bit worried about your technique, for example, you might have heard that if you do an exercise the wrong way, it's going to kind of cause pain. Then a good way to do it would be, as I said, either follow a video where they have different options. So you might start with like a lightweight, something that doesn't feel too heavy, and then build up. And with the gym, if you want to specifically go back to the gym and you're a little bit worried about kind of doing it right, then it would be a good option to speak to a physio or a personal trainer about getting that exercise and referral to kind of build up your confidence, so that you feel confident that you're managing the exercises in the right way. But if you've got someone there to instruct you, or if you're following instructions and you're starting at a lower intensity and building up gradually, that should kind of reduce those risks of doing the wrong exercise. And I'm going to say again, it's about listening to your body. So if you're doing an exercise and it doesn't feel right, and you feel like you're getting a bit of pain from it, then you need to stop that exercise and think about doing something different.
I think we have another question.
Yes. So I don't know how much truth there is in this, but I've occasionally been heard that if you've done hard exercise and you've built up a lot of lactic acid in your muscles, then your liver has to work a little bit harder to clear that out, and it can lead you to, if you, for instance, if you do it the day before or on the day you've gone in for a blood test, regular blood test, your liver functions can be out of whack a bit as a result of hard exercises. Is that nonsense? Can that be the case?
That's a good question. There's some evidence to that. So I've seen this with my partner, who did a really heavy exercise session the day before he went for a blood test, because he's had cancer himself as well, and his levels were through the roof. And I was like, it was a bit worrying, but actually it was related to the cancer. I'm sorry, it was related to the exercise, not the cancer. And the thing about that is your body can repair from that, and it's very transient, so it's very short-lived. So in terms of very extreme exercise, doing a lot of that would be kind of very heavy weightlifting, very intensive cardio. And what I would recommend around that is that you don't do it on your day of treatment. So if you're having, for example, kind of IV chemo, then we wouldn't recommend that. but also you might for that reason not want to do a very, very heavy exercise session the day before your blood test. But I'm talking quite extreme exercise here, because what it is, as you said, like that buildup of lactate and other inflammatory cytokines and other inflammatory hormones in your body. So it's only very extreme kind of heavy exercise that will cause that effect in your bloods, but it's a transient effect as well.
Wonderful, thank you.
Thank you very much indeed, Faye. So I'd like to say thank you very much for struggling through your COVID and actually being able to deliver your session this morning. So thank you very much indeed for sharing that with us. So, and I think we'll all want to share our appreciation. Thank you, Faye. So.